Dear phlebotomists, if you're gearing up for your NHA/CPT exam, then you know urinalysis is a huge topic. Well, in this explainer, we're going to make it super simple. We are going to follow one single urine specimen all the way through its journey, from the moment of collection to the final result, hitting every key step you absolutely need to know.
So, here's our game plan. It's a journey with 5 main stops. We'll kick things off with getting that perfect collection. Then, we'll literally race against the clock with preservation. After that, it's all about decoding the clues during the analysis, making sure our work is spot on with quality control, and finally, learning that crucial skill of knowing when a sample just isn't good enough. Ready? Let's get started.
All right, let's start at the very beginning. Getting a perfect collection, it's not just a suggestion, It's the absolute foundation for every single valid result that comes after. This is where quality begins.
So, think about it. What's the very first thing you have to nail to make sure the doctor gets a report they can trust? Where does it all really begin?
Here's the bottom line. The work you do before the sample even hits the lab, that pre-analytical phase, is honestly the most important step in the whole process. If you make a mistake here, there's no fixing it later on.
Now, this slide is a big deal for the exam. You have to match the collection method to what the test is for. So on the left, a pediatric bag, totally fine for a basic screening test. But look over to the right. If a doctor orders a culture to check for an infection, you have to use a sterile method, like a catheter. Using the wrong one means getting the wrong answer. Simple as that. And this right here is a rule you just can't bend. Ever. It's a huge red flag on your exam. Using a bag for a culture is a major no-no. Why? Because you're almost guaranteed to get skin bacteria in there, which could cause a false positive and lead to a kid getting antibiotics they don't even need. Okay, so you've got that perfect sample in your hands. Guess what? The clock is now ticking. Our next section is all about that golden window, that critical dance between time and temperature. Seriously, if you only memorize one number from this whole explainer, make it this one: 2 hours. After 2 hours, just sitting on a counter, bacteria start to grow like crazy, cells start to break down, and your results just become unreliable. Think of this table as your study guide for preservation. And notice the pattern, right? For every problem, there's a specific fix. If you know there's going to be a delay, you pop it in the fridge. If you're testing for bilirubin, which breaks down in light, you protect it. And for delayed culture, you either refrigerate it or use a special tube with boric acid to keep that bacteria count just right. All right, our specimen is preserved, and it has officially arrived in the lab. Now we get to the fun part, breaking down the actual analysis. This is where we start digging for clues. A full urinalysis has these 3 parts, and they all have to work together. It's like a system of checks and balances. The story that the physical appearance tells you should line up with the chemical results, and both of those should be backed up by what you actually see under the microscope. So the first step is just using your eyes. You get a sample and it looks just like this. It's a dark amber color, and when you give it a little swirl, this really noticeable yellow foam appears. What's the first thing that should pop in your head? And there it is, the connection. That visual clue points you straight to a chemical finding. Yellow foam is a classic sign of bilirubin, which can be a huge indicator of liver issues. Just by looking, you've already found the first piece of the puzzle. For your exam, you need to know this procedure like the back of your hand. It's not just about dunking a stick in some urine. You have to dip it briefly, blot the edge, so important to stop chemicals from running between pads, and the big one, time it perfectly. Reading a pad even a few seconds too early or too late can completely invalidate the test. Okay, so even if you have a perfect sample and you did the technique perfectly, how do you prove your results are right? That's where quality control, or QC, comes in. Because a result that you can't trust is, well, completely worthless. Let's be really clear. These aren't just suggestions. These are the absolute rules for getting valid results. And notice, every single step is about protecting those reagent strips and making sure they work before you even think about testing a patient's sample. And if you don't document it, it didn't happen. And this slide right here is the bottom line. If your quality control is failed or it's overdue, you stop. Full stop. You cannot, under any circumstances, report patient results. It's so important that a lot of the new machines will actually lock you out if QC isn't right. It's a final safety net for the patient. And you have to be on the lookout for things that interfere with the test. This one is a biggie for the exam. If a patient is taking a lot of vitamin C, Their urine can give you false negatives for really important things like blood, nitrates, and glucose. It basically masks the problem, making things look normal when they're not. And that brings us to our final, and maybe one of the most critical, steps: deciding if a specimen is even good enough to test in the first place. This is a huge part of your professional judgment. You have to be a bit of a detective here. Is that patient label absolutely perfect? Is the container leaking? Is this that same sample that's been sitting out for 3 hours and never made it into the fridge? Accepting a bad specimen is just as bad as doing the test wrong, because you know the result is going to be junk. And this is exactly why rejecting a bad sample is so important. If you knowingly test a compromised specimen and report that result, that's a serious quality violation. A doctor is going to make a treatment decision based on your work. A bad sample can lead to a bad decision, and that can have very real consequences for a patient. So as you study for your exam and get ready for your career, really think about this. Out of everything we've talked about, what's the one single checkpoint you will make a habit of verifying every single time? Because that diligence is what good patient care is all about.